to you by NJIT, New Jersey Institute of Technology.
We're joined by Tomas Gregorio, who is Senior Executive Director, New Jersey Innovation Institute and NJIT Corporation. Good to see you, Tomas.
Good to see you, too.
We've talked to many of the folks at the Institute, but this is about your healthcare arm. Talk about that.
Right. So one of the labs is the healthcare lab, the one that I am responsible for. We've been able to apply for several grants on this. On another show, we talked about it briefly. We hadn't gotten to that point yet. So now we've been awarded $50 million, 49.6
From the federal government?
CMS.
To do what?
To assist physicians in transforming their practices from being paid for seeing every patient to being paid for the value that you provide.
What role does technology play in that?
Huge role.
Explain.
Huge role.
Give us a for instance.
For instance, being able to drive down a particular cost or to improve to a best practice, being able to identify patients that go to the emergency room, let's say, the readmission problem. Well, you can, with the data that you consume, predict who is going to be a high utilizer, what is the pathology of those types of patients, so that you can identify them, then you case manage them, and you build them into your community, reducing the readmission cost.
Electronic medical records. Is that what we're talking about?
It's the interoperability of them.
Whoa, explain what that means.
What that means is to be able to have them talk to each other. Because think about every hospital as having its own electronic medical record. Every hospital system having its own connected medical record.
How about if they're able to talk to each other?
Correct.
Then what happens?
Now we're able to mine that data to determine which of those patients we should go after to try to help to reduce readmissions or, control diabetes. Or
What do you mean go after? Communicate with them and say, hey, you need to come in?
What are the things that they need, right? Do they need somebody to call them and just remind them to take their medications? Do they actually need a nurse to remind them of their medications and why they take them? What do we provide them? Because the last mile is the patient, right? They are the ones that have to adapt to the therapies in order for it to be able to work. So data and electronic records help you get to precision medicine, which is the future, and it's an awesome place to be.
It's amazing. And you started off, I remember you were talking, $1 million came in, and now how much are we talking about?
Well, in the last 17 months, we've been able to generate $17 million in awards between interoperability, the word that I used about connecting, as well as this other grant to help provide the boots on the ground so that physicians can adapt to this new way of how they're going to get paid.
Are they adapting?
No. It's something that...
Are physicians saying, hey, come and help us, or are they saying, hey, wait a minute?
It's a little bit of both.
Is it a selling job?
A little bit. They need to understand, not until they understand that not changing is going to affect them, or until some of them are affected by penalties or lower reimbursements.
Hold on. The federal government will provide less reimbursement if they do not reduce readmission into the hospital. If they do not do what? What else?
If they don't adapt to a certain way of treating certain types of patients, diabetics in a certain way, at a certain measurement. You don't get a bonus payment, or you won't get paid at all.
And people have to get better.
That's correct.
And if people don't get better on some level, you're saying medical professionals are going to be penalized.
That's correct.
And this data is supposed to help make the treatment more effective.
More effective, or the decision-making for the provider or for the nurse, easier for them to be able to do their job.
And a lot of where you're doing this is in Newark, right?
Yes.
Where?
Yes. So we run a network of 5 hospitals, universities.
Pretty much those are the major hospitals.
That's right.
Are they talking to each other?
That's right. So
Are they really?
We have interoperability between them so that a patient who's admitted in one place or another, they can use that information. We have patients that are logging in some cases. We had students walk around through the hospital helping the patients learn how to log into the patient portal. So it's growing, and the more data you have, the better you can solve the problems.
Is this the wave, I hate to use this expression, the wave of the future? This is it? Or the future is now?
Well, we're scratching the surface, right? How do you get to the point where it's, you know, your smartphone, right? When's the last time you opened up your manual on your smartphone?
You're right.
Right. So we build all of this infrastructure so that we can get to the point where you don't need a manual, and that takes time.
And you also have to, there's an education process for people who are not that familiar with the technology.
Absolutely, absolutely. And, you know, it takes time for them to adapt. So you have to give them that crawl, walk, run scenario, right? Being able to mature at their own level, and this grant helps us do that.
And tremendous amounts of money being saved over time, finally?
Well, our goal is to do a $250 million reduction over 4 years.
Well, clarify that.
Right, so they gave us $50 million program, and we have to reduce the total cost of care per patient by $250 million. That's the opportunity, and that's what we signed up for.
Tomas Gregorio is part of the New Jersey Innovation Institute at the New Jersey Institute of Technology, the NJIT Corporation. You're a senior executive director there, and Don Sebastian, a team there, and Dr. Bloom and the whole team of folks at NJIT. Thank you for joining us and talking to us about how technology is being used in the field of medicine.
I think at NJIT there are a lot of smart students.
I came to NJIT for mechanical engineering because with in-state, it's one of probably the top 3 schools for engineering.
It sort of creates a friendly competition where you know you can learn from them.
It's a great academic school.
I feel I'm being challenged, but at the same time, I love the classes I'm taking.
The atmosphere of being here is like being at an upstart company. It's that same kind of drive, that same kind of passion.
Also brought to you by the New Jersey Office of the Insurance Fraud Prosecutor, Hackensack University Health Network, and by MagnaCare.